Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about naproxen. Naproxen is a nonsteroidal anti-inflammatory drug, a so-called NSAID. It's in the same family as ibuprofen, was patented in 1967, came on the market in the United States 1976, 71st most frequently prescribed medicine here, more than 11 million prescriptions, and since 1994 it's available over the counter. So countless number of people taking the medicine, just going to the grocery store or the pharmacy and buying the bottle of it. It's still prescription in many parts of the world. Comes as two different kinds of medicines. Comes as naproxen by itself or naproxen sodium. If you get the naproxen sodium, it's going to be absorbed more rapidly, going to reach a peak in the bloodstream after about 1 to 2 hours, as opposed to the naproxen that's going to take 2 to 4 hours to peak. Well, if you buy the Anaprox, that's naproxen. If you buy the Aleve, that's naproxen sodium. Now, when you look at the medicine, it could either be immediate release or delayed release. So if it's delayed release, that's going to be either a sustained release or an enteric-coated form. Those seem to be less rapidly absorbed, so you get the effectiveness somewhat later on in more delayed fashion, so better for chronic pain rather than acute pain. So if you talk about the enterocoated naproxen, well, it's got a pH-sensitive capsule, so it's not going to dissolve in the acid of the stomach. It's going to wait till it gets to a more neutral pH in the small intestine before the capsule is dissolved, loses its integrity, and then it can be absorbed into the system. But it's going to take somewhere between 4 and 6 hours to peak. And if you happen to take it with food, well, it's going to be delayed for an average of about 12 hours after you take the medicine. So most people don't want to wait that long unless you have chronic pain, in which case you're taking it all the time. So there's always going to be some in the system. Well, the regular naproxen and the enterocoated naproxen come in 250 milligram, 375, and 500 milligram. Delayed release comes in 375 or 500 milligrams. Now, naproxen sodium comes in 220 milligrams, or as a prescription as 275 milligram and 550 milligrams. But remember, the naproxen sodium, Aleve, that contains, let's say, the 275 milligram. It contains 250 milligrams of the naproxen and 25 milligrams of sodium. The double strength, 550 milligrams of Aleve, well, it's 500 milligrams of naproxen and 50 milligrams of sodium. So be careful if you happen to have high blood pressure, if you happen to have congestive heart failure, if you have a heart attack, if you have something wrong with your cardiovascular system, if you have something wrong with your kidneys, then you need to be a little careful about the amount of sodium that you're going to consume. But irrespective of the form, it's going to circulate, once it gets into the body, it circulates as naproxen. Just varies with how long it's going to take to get there. Now, what does it treat? It treats the same thing as ibuprofen. It's good for pain, it's good for inflammation, it's good for fever. You should take it in the lowest possible dose for the shortest period of time, because remember, all of these medicines do have some side effects. And also remember that all fever-reducing medicines are not anti-inflammatory. So acetaminophen or Tylenol, that's not anti-inflammatory. And as a matter of fact, if you just pop naproxen every once in a while, that's not a high enough dose. You need a relatively high dose for it to be anti-inflammatory. Indications? Well, migraine headache, osteoarthritis, rheumatoid arthritis. Some people take it for psoriatic arthritis or gout or menstrual cramps, tendinitis, bursitis, kidney stones. Some people even use it as a bridge if they have medicine overuse headache, to get off of the fancier medicines they're taking and get down to something more reasonable, or get off medicine altogether. Well, if we look at how it affects, say, rheumatoid arthritis, taken at a higher dose, it decreases joint swelling, decreases the duration of the morning stiffness, decreases the disease activity, increases mobility. So relatively good medicine, relatively strong medicine, but even though it's readily accessible, it does have some side effects. Comes with a black box warning. The FDA mandates that everybody who takes the drug should be aware that it can increase the risk of cardiovascular thrombotic events, like heart attacks and stroke, that can be fatal, that can occur early in the course of treatment, that increase with the length of therapy, and it can cause gastrointestinal bleeding. Cause not only bleeding, but can cause stomach ulcers and perforation of the stomach or the intestine that can be fatal. And that can occur anytime during the course of therapy, more commonly in elderly individuals, people who have a history of peptic ulcer disease, people who have a history of gastrointestinal bleeding. Got to be careful of these drugs. Well, the drug is actually what's considered to be a non-specific COX inhibitor. Now, COX, or cyclooxygenase, is an enzyme. It's associated with the production of prostaglandins. That's an important signaling molecule, keeps certain of the vessels open, seems to sensitize the nerves to pain, is involved in the inflammatory process. So if we decrease the amount of prostaglandins, well, one of the things that's going to happen is we're going to decrease the fever, we're going to decrease the pain, going to cut down on inflammation, and all that's relatively good, but unfortunately it's doing some bad things too, and that's why you get the ulcers, and that's why you can get the heart attack and stroke. The onset, typically within about an hour or so after you've taken the medicine, assuming you're talking about the immediate release form, it's going to peak in the body within 1 to 4 hours, depending on the form. The duration is going to be about 12 hours. Small amount is going to be present in the breast milk, but it's only about 1% of the mother's plasma concentration. So if a mother wants to breastfeed the child, that's probably okay. 95% of the medicine is going to be bioavailable. It's going to peak within 1 to 4 hours, as I mentioned. It's going to stay, as far as the half-life is concerned, for somewhere between about 12 and 17 hours. It's going to reach a steady state after about 4 or 5 hours, which means that if you take just one pill one time, that's not going to provide the peak activity. You have to take it for several days in order for the medicine to reach the full benefit, to provide the full benefit. And 99% of the medicine floating around the system is going to be bound to albumin. It's going to be conjugated in the liver, and it's going to be passed out in the urine. Now, there's some drug metabolizing enzymes, but they're not the primary mode of metabolism for the drug. Seems that one of those drug metabolizing enzymes, known as 2C9, well, that's important because a lot of people have different levels of 2C9. And if you don't have an adequate level, that means that the naproxen is going to build up in the system a little bit, and that might be associated with a higher risk of gastrointestinal bleeding. Well, you have to be careful if you're taking other kind of medicine. So if you're taking lithium because you have bipolar disorder, well, if you take the naproxen with the lithium, it's going to increase the lithium concentration about 15%, decrease the clearance of the lithium by about 20%. That might be enough to cause some lithium toxicity. So you have to be careful. And then it can increase the concentration of methotrexate that you might be taking for psoriasis or for rheumatoid arthritis. It can increase the concentration of cyclosporin A in the system. You have to be careful if you're taking one of the antidepressants, the popular antidepressants like the SSRIs, Prozac, Paxil, Zoloft, Celexa. Seems that they increase the likelihood of bleeding, and when you combine them with the naproxen, you might have some extra bleeding problems. So it's not a contraindication, but you do have to be a little careful. Now, on the other hand, if you happen to be taking warfarin or some of the blood thinners, then you have to be a little bit extra cautious, because that's when some of the serious bleeding disorders may occur with increased frequency. And you have to be careful if you have certain kind of medication that you're taking, say for blood pressure. Well, the naproxen makes those blood pressure reducing medicines not work nearly as well. And if you happen to be taking a medicine known as probenecid, sometimes used for gout, well, that's going to increase the amount of the naproxen inside the system, going to decrease the clearance of naproxen, and that might lead to increased toxicity. Well, it's going out mostly in the urine, mostly as a conjugated product. A little bit goes out in the feces. Got to be careful if you're drinking alcohol, because remember, alcohol increases the risk of intestinal irritation, stomach irritation, and then you throw in the naproxen to boot, and that can increase the likelihood of GI bleeding. Shouldn't take naproxen if you're hypersensitive to either it or to aspirin, or if you have a history of asthma. If you have a history of asthma, or maybe some nasal polyposis, nasal polyps, or chronic rhinosinusitis, you're allergic to aspirin or other nonsteroidal anti-inflammatory drugs, you could have a fatal reaction to this medicine. So you just stay away from it. And if you happen to have recently had coronary bypass surgery, it seems that these kind of medicines increase the risk of myocardial infarction, heart attack, and stroke. So you shouldn't take it within at least 10 to 14 days of having cardiovascular surgery. Seems that the risk is highest in the first week, but the risk seems to persist, even though it's a lower level, for up to 4 years. So in the setting of cardiovascular bypass surgery, very careful, try to avoid the medicine. Chronic toxicity, well, it's much more than acute toxicity. Actually, if you take the drug on a regular basis, you have a 2 to a 10-fold increase in the likelihood of complications, rather than if you just take a pill every now and then. Side effects with chronic drug use, chronic naproxen use, well, it can cause some dizziness and headache and bruising, cause allergic reactions and heartburn, and some people cause shortness of breath and lightheadedness, and sometimes an itchy rash. Sometimes because it causes you to retain sodium, might lead to some leg or ankle swelling. Pediatric population seems to be associated with an increased risk of rashes and bleeding, but lower risk of GI irritation and central nervous system problems. Otherwise, seems to cause fewer problems in the pediatric population than it does in adults. If a woman is pregnant, should not take the medicine, especially in the 3rd trimester, because it might lead to premature closure of something known as a patent ductus arteriosus. A patent ductus is an opening that goes from the aorta to the pulmonary artery, keeps the pressures normalized. So you don't want to close that off, and the naproxen might cause an increased likelihood of that little connection closing. Also have to be a little careful if you have high blood pressure. It might actually cause high blood pressure, or will cause worsening of high blood pressure that's already been controlled on medicine, because when you take the naproxen, it's going to make you retain sodium, going to change the way the kidneys function a little bit, and then the thiazide diuretics and the ACE inhibitors don't seem to work as well. And if you use a lot of the medicine, the naproxen might lead to some kidney problems or kidney failure or end-stage renal disease. And you have to be careful of the potential for severe reactions. Remember the gastrointestinal bleeding and the heart disease and the stroke, liver toxicity. We know that if we monitor a person's liver enzymes that are present in the bloodstream, we find that about 15% of people who take naproxen on a chronic basis are going to have increased amount of those enzymes, but about 1% of those people are going to have an increase that's more than 3 times the normal level, the upper level of normal. And sometimes that might progress on to fulminant liver failure. So you do have to be careful if you develop some new kind of problems, you develop nausea or fatigue while you're taking the medicine, or you become lethargic, or you suffer from diarrhea or itchy rash, or you have jaundice, your skin turns yellowish, or you develop pain under your rib cage on the upper right side, then you have to be careful. Tell your doctor. And gastrointestinal bleeding does occur when people take naproxen. So you can get some heartburn and some nausea and constipation and diarrhea. That's all to be expected. But it can cause ulcers and stomach bleeding. But it seems that 1,000 milligrams a day of naproxen, total dose, seems to cause less bleeding, say, than 650 milligrams of aspirin every 4 hours while you're awake. So some people take it with food to decrease the gastrointestinal side effects. Whether that really is effective or not is difficult to say. There's a group of people with a history of peptic ulcer disease or inflammatory bowel disease. You should ask your doctor about whether you should take the medicine. And remember, if you take naproxen on a chronic basis, it can cause some serious side effects. And those serious side effects typically occur without any warning. Only about 20% of the people get some kind of warning symptom. 80% of the time, those serious side effects, the gastrointestinal bleeding or the perforation occurs, and you have no warning. So the lowest dose for the shortest period of time. Acetaminophen causes the least number of gastrointestinal problems, then comes ibuprofen, then comes naproxen, then comes indocin. If you happen to have a history of peptic ulcer disease, you have about a 10-fold increase in your risk of gastrointestinal bleeding. And if you take the drug for a long period of time, if you take it with anticoagulants, if you take it with the SSRIs, Prozac and Paxil and Celexa, if you're a cigarette smoker, you drink alcohol, you're older, or you're in poor health, you have an increased incidence of gastrointestinal bleeding. So on average, gastrointestinal bleeding or perforation occurs about 1% of people have been taking the drug for 3 to 6 months. About 2 to 4% of the people have been taking the drug for around a year. Now there's a link to cardiovascular events also. Heart attack and stroke. These can occur as early as the first week that you're taking the medicine. But they increase in incidence the longer you're taking the medicine. So overall, when we look at the NSAIDs, it seems that the risk of heart disease is probably relatively small with the naproxen. It seems that the risk of stroke is probably about half of what it is if you were taking the ibuprofen. So it seems that if we look at a control population, well, the naproxen isn't going to significantly increase the risk, but as a reminder, it certainly can increase the risk of gastrointestinal bleeding, and it does that more than the ibuprofen. Now, some people use it to delay the premature labor, but unfortunately, when it's given to neonates, it can increase a variety of complications, from pulmonary hypertension to certain kidney dysfunction, causing intracranial hemorrhage. So it's not appropriate for the newborns. Safety and efficacy not established less than 2 years of age. But in children, actually, it's only really been studied in those individuals who have juvenile rheumatoid arthritis. And for people with juvenile rheumatoid arthritis, the drug seems to be relatively well tolerated. Person is 5 to 16 years of age with arthritis. Well, the plasma concentration seems to be about the same as with adults when we dose appropriately. Older population, geriatric population, there's an issue, and the issue is that more of the medicine circulates in the unbound fraction. It's the unbound fraction that causes, one, the disease, or one, the medicine to be active, but two, the side effect profile to be higher. So the unbound fraction is 2 to 3 times higher in the elderly individuals as it is in younger individuals. And that means that probably there's an increased susceptibility in the elderly population to the complications, the peptic ulcer disease and the bleeding, all because of the unbound naproxen. Liver disease, it's not well studied, but in people who have chronic alcoholic liver disease, they're not going to have as much albumin floating around. And it's the substance, the albumin is a protein in the body that's made by the liver. Well, if you don't have enough of the albumin, that means more of the naproxen is going to float around unbound, cause more problems. Same thing with renal impairment. It's not really well studied. It's excreted by the kidney. So if you happen to have kidney disease, you have to be a little careful of this medicine, because that means it could accumulate in the system. And it can cause an increase in the amount of potassium, even if you don't have any renal involvement. So you have to be careful, especially if you have a variety of other conditions where the potassium level might be important. And it can cause kidney dysfunction. It can cause papillary necrosis. So especially those people who are at risk, the elderly, the people who are dehydrated, people who have liver disease or heart failure at high risk. And it can cause heart failure and edema because it causes the retention of sodium. And that leads to an increase, again, in the risk of heart attack and stroke. Not only that, but it seems that taking the naproxen, because of the effect in the sodium, can blunt the cardiovascular effects of the diuretics and the antihypertensive medicine that you happen to be taking. And remember, there is sodium in the naproxen. Sodium causes anemia, and we don't know exactly why it causes anemia. Sometimes it can cause anemia because of an increased blood loss, either occult blood loss that you're not aware of, or it can cause some gross bleeding, or it can cause some fluid retention, and that's a dilutional anemia that you can develop, or it can decrease the erythropoietin, that's a substance that the body makes to help manufacture the red blood cells. So if you're taking the medicine, and if you have a hemoglobin of less than 10, then you need to have it periodically checked. It seems that the effectiveness, at least as far as pain control is concerned, naproxen seems to be pretty much the same as aspirin or indomethacin, not carcinogenic. Might have some impact on fertility, might have some impact on the sperm. Now, because it's anti-inflammatory, some people think that it's a substitute for taking steroids, the prednisone or cortisone. Well, if you've been taking prednisone or cortisone, this is not a substitute, so you can't just stop your cortisone dose or your prednisone dose. Your adrenal gland needs to continue your taking the prednisone or the cortisone. Now, also remember that even though we talk about people taking low-dose aspirin to help prevent a heart attack, and you should watch my show on that because there's some question. But if you happen to combine naproxen with low-dose aspirin, you significantly increase your risk of gastrointestinal disease. And remember, because it can reduce the fever, well, that means that if you happen to have an infection, it might hide it. And in animal studies, it seems that naproxen has some negative impact on vision. So if you're taking it for a long term, probably ought to check with your eye doctor every once in a while. You could overdose on the medicine. If you overdose on the medicine, nausea and vomiting and lethargy and drowsiness, sometimes cause some epigastric pain or gastrointestinal bleeding, kidney failure, respiratory depression, sometimes lead to convulsions or even coma. Well, you take the appropriate dose for the condition that you suffer, but you don't take more than 1,000 milligrams on a regular basis, or with the consent of your doctor, you can go up to 1,500 milligrams for a short period of time. But you don't want to overdo it, because remember, the drug is associated with significant toxicity at a higher dose, at a longer dose. And now they're making the naproxen, they're combining it with one of the proton pump inhibitors, they combine it with some of the sinus medicines, now they combine it with sumatriptan for people who have migraine headaches. So that's the story of naproxen. You could get it over the counter or with a prescription, get it as Aleve, that's a naproxen sodium, or the Anaprox, that's the regular naproxen. You can get it as the brand name drug or the house brand from almost any grocery store chain. It's relatively inexpensive. Seems to be a good medicine for fever and pain and inflammation. But don't abuse the medicine, because remember, it does have a significant number of side effects. And especially if you happen to have something wrong otherwise, you're elderly, you have a history of gastrointestinal bleeding, you have a history of ulcers, you have a history of kidney disease, liver disease. Got to be careful of this kind of medicine. So use it, but only use it appropriately and use it for the shortest period of time. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.